USMLE style question. Subarachnoid hemorrhage. A 48-year-old woman presents to the emergency department with a sudden onset of severe headache, described as the worst headache of my life. She is also experiencing nausea, vomiting, and photophobia. Her past medical history is unremarkable, but she has a family history of aneurysms. On examination, she is alert and oriented, but she appears distressed and dizzy. Her blood pressure is 150/90 mmHg, and her heart rate is 95 BPM. Neurological examination is normal, with no focal deficits. A CT scan of the head reveals hyperdense blood in the subarachnoid space. Which of the following is the most likely cause of this patient's condition? A. Rupture of a berry aneurysm. B. Rupture of a bridging vein. C. Rupture of middle meningeal artery. D. Intracerebral hemorrhage. Cerebral venous thrombosis. Answer: A. Rupture of a berry aneurysm. Explanation: subarachnoid hemorrhage, SAH, is most commonly caused by the rupture of a cerebral aneurysm, particularly a berry aneurysm, which typically occurs at the branch points of large arteries, e.g. at the circle of Willis. Classic presentation: sudden, severe headache described as the worst headache of my life, nausea, vomiting, and photophobia due to increased intracranial pressure. In some cases, there may be meningeal irritation, e.g. neck stiffness, positive Brudzinski sign. On CT scan, the hallmark finding is hyperdense blood in the subarachnoid space, between the pia mater and arachnoid mater. Why other choices are incorrect. B. Rupture of a bridging vein causes subdural hematoma, which appears as a crescent-shaped collection of blood on CT, typically associated with slower onset of symptoms and head injury. C. Rupture of middle meningeal artery causes epidural hematoma, which typically presents with a lucid interval followed by rapid deterioration. The CT scan will show a biconvex, lens-shaped hemorrhage. Intracerebral hemorrhage results from hypertension, trauma, or vascular malformations and appears as a localized mass within the brain parenchyma. It does not present with a thunderclap headache and subarachnoid blood. E. Cerebral venous thrombosis can cause headache and neurological symptoms, but it typically results in venous infarction and is associated with elevated intracranial pressure, not a sudden onset of severe headache with blood in the subarachnoid space. Clinical relevance. Risk factors for SAH include family history of aneurysms or polycytic kidney disease, PKD, hypertension, smoking, and advanced age. Congenital defects such as Ehlers-Danlos syndrome or Marfan syndrome. Diagnosis. Non-contrast CT scan is the first step in diagnosis, revealing blood in the subarachnoid space. If the CT is negative and clinical suspicion is high, lumbar puncture can be performed to detect xanthochromia, yellow appearance of CSF due to breakdown of red blood cells. Management. Supportive care, including blood pressure management. Surgical treatment for aneurysm rupture typically involves clipping or coiling to prevent rebleeding. Would you like to explore diagnostic steps for SAH?